we are live.
All right, welcome everybody to the Melanin Initiative. Here in healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space to ask your questions and share our nursing perspective without taking too much of your time. Today, we'll be speaking with our special guest, Dr. Linda Brooks Johnson. Today, we are honored to truly have an inspiring guest with us in recognition of Breast Cancer Awareness Month. Dr. Linda Brooks Johnson is a certified personal life coach who specializes in helping breast cancer patients and survivors, as well as individuals navigating grief, divorce, and caregiving. As a two-time breast cancer survivor herself, Dr. Linda is not only a powerful advocate for breast cancer awareness, but also a motivational speaker and a guiding light for those going through life's toughest transitions. Her motto, "You make the choice, God will make the change," encapsulates her faith-driven approach to helping others transform their lives. We're thrilled to welcome Dr. Linda to our show today.
Thank you.
If you're new here, welcome to the Melanin Initiative. I am Alicia, and I co-host the Melanin Initiative podcast along with Geraldine and Kimberly, who sends her love in her absence. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, we hope you feel empowered to ask questions, educate on how to manage your health, and confident to navigate the healthcare system. If you haven't already, subscribe so you can be notified when we release a new episode. Thumbs up the video and leave a comment or two. It helps us help you. It also shows YouTube this content is valuable and helps to make sure YouTube shows our content to those who need to hear it. As a reminder, this show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988 or text 741-741. So welcome, Dr. Linda. We are very excited to have you here today.
Thank you. I'm happy to be with you guys today.
Thank you. So to start off, Coach Johnson, can you share a little bit about your journey and what inspired you to become a life coach, especially working with breast cancer patients and survivors?
I was diagnosed at the age of 39 after finding a lump about 10 months after my mammography. I had just had my last child and he was 6 months old, and then I was diagnosed. I tell you, it was a tizzy because at that time I was laid off with IBM. Ex-husband walked out and canceled me off the insurance.
Wow.
So there I was going through what I thought was just a crisis with the job, but it was a life crisis. But moving forward, God's grace was what brought me through that. And then in 2018, I was diagnosed again with the same breast cancer. The only difference, the first one was positive. No, the first one was negative, and the second one was positive. I elected not to do chemotherapy, just to do the double mastectomies. But however, my oncologist still wanted me to go through chemotherapy until I found out I was allergic to it. That set off a whole nother can of worms, but we got through that. No more chemotherapy after that one round, and I'm happy to say we're cancer-free ever since. So I thank God for that. What led me into life coaching breast cancer patients and survivors was looking at what my journey was. I really felt that I needed to do something to give back. There was a lot of things that I found out that, wasn't necessarily fair, but I learned how to navigate through it. And that's when my purpose of wanting to know what God wanted me to do, because I believe that through every ounce of your pain is power, and that power is used for purpose. And my purpose was to let others know that you can travel this journey and that there is life outside of a cancer diagnosis. So what I incorporated when, friends was telling me, hey, you're giving advice anyway, why not go and do it professionally and see how your advice has been given to change lives of others. So that's what I started doing. Went and got certification in March of this year. I got my PhD in humanitarian leadership. So what I'm doing now is trying to let survivors and also early diagnosed patients know that you can do anything you set your mind to. Just because you've been diagnosed with cancer doesn't mean that you stop living. You still have goals and aspirations that you had before cancer. Cancer is just a chapter of your book, it's not your whole book. And the more you concentrate on life, the more you give cancer a good punch.
So yeah, as you mentioned, you're a two-time breast cancer survivor. How has your personal experience shaped the way you coach others who are going through similar?
Well, I've learned that even through the coaching of breast cancer and any other kind of cancer or caregivers, divorce, grief, I don't coach anything that I haven't gone through. Because I'm just a firm believer that I can't really talk about something that I have no inkling of, no experience in, and haven't walked in those shoes. So I look at it as I can offer up more intensity and sensitivity when it comes to coaching what I know. Now, I do things a little bit different. My platform is strictly biblical. I don't touch anybody that don't want a personal experience with God and don't pray. Because I can't help you if you don't allow God to help me help you. And the only way we can do that is through prayer.
Wow, that is a powerful message, Dr. Johnson. So my next question for you is, since October is Breast Cancer Awareness Month, what key messages or advice do you have for people, both men and women, about early detection and support?
Make sure every month that you're doing self-exams. Make sure you do the annual exams where the doctor's checking you. And if you're at that age where you can get the mammographies, please get the 3D mammograms because they're more, especially for Black women and men. We have a sense of having density. And with the 3D mammogram, it will cover everything that the regular mammogram doesn't.
Wonderful. So
I was unaware of that. That's interesting that I didn't know that it was like a 3D mammogram.
Yeah.
That's more or a better diagnostic tool for.
Exactly. It used to be where insurance wouldn't pay for it, but I've been lobbying in Washington for the last 3 years, making sure that cancer, breast cancer, ovarian cancer, and uterine cancers especially, are given those diagnostic testing that makes a world of difference.
Right. Since we're on the topic of diagnoses, you mentioned previously the first time you were diagnosed with negative and the second time with positive. Could you explain to our audience the difference between negative and positive?
The negative positives just only mean the estrogen receptor, meaning that estrogen was drawing the second one and it wasn't with the first one. So normally when you have a positive, they want to do hormonal therapy. Some people agree to get it done. When I researched it, it was not for me. There was too many of the cons there that I was a little worried about, and especially having a negative and a positive and then taking the hormones. I had to look at that first diagnosis because that still has a bearing on my outcome.
All righty. So what do you think are some of the biggest challenges breast cancer patients face, and how can loved ones best support them during and after treatment?
I think the biggest barrier out there right now is the disparity in the Black community. We still are not getting the information and going and getting the diagnostic testing and being informed. Why that is, I don't know, but Black women are dying at a higher rate than white women and other minority groups. And for the lack of me, I don't know why that is, because there's so much advocacy out there now that I don't understand. And a lot of what we're seeing now is women that are very young are getting diagnosed. I think right now on record, the youngest breast cancer patient or survivor had a single mastectomy, and she's 9 years old.
Wow.
Oh, wow.
And before that one, the earliest was 16 years old.
Wow.
So I would say not only women need to be aggressive in checking, but make sure you get your daughters checked too. Because I think a lot of things that we're facing and seeing now is coming from environment and food.
Right. It's interesting you said that, because I remember in college I had one of a classmate or a friend that same thing. She was diagnosed at 12. And when she said that she, felt a lump, like she brought it up to her doctor, pediatrician, or whoever was seeing her. And because of her age, they kind of just ignored it and was like, you're fine. And it turned out she actually did have breast cancer. I don't remember the full details and how she was able to finally get checked and diagnosed. But I do remember her stating that like it was kind of brushed off because she's 12.
And that's, it's sad, but not only with that young age, but even women under the baseline of 40, they just dismiss it. But that's where it comes in. You got to be your own advocate. You don't let anyone tell you differently than what you feel and know. Nobody knows your body but you. Right. And it's crucial that if you feel something or you know something, you keep going until you're heard. You matter. Your voice matters. You need to be heard and you need to be addressed. And if you're not, keep pursuing it until you find someone that will.
Right.
Absolutely. And you brought up a key word there, which is advocacy.
Yeah.
And we know that you are both an advocate and a coach for cancer survivors. Mm-hmm. So how do you balance these roles? And how does your advocacy work feed into your coaching practice?
Well, it's a twofold, because a lot of times I'm hearing clients talk about that. Matter of fact, I had a client the other day was getting pushback on diagnostic testing with getting MRIs. I mean, not MRIs, PET scans. And that's crucial for a cancer patient. CAT scan, PET scans, CT scans, those are crucial. And she was talking to the provider's, I think, customer service rep. And the provider, customer service rep, asked her what was a mastectomy. And I'm like, you gotta be kidding me. But she asked her, what is a mastectomy? Now, this was a woman that was on the phone with her, trying to explain why it kept denying her from getting the PET scan. And she's going to ask her, what is a mastectomy?
Yeah.
That's the communication gap. We've got to be more informative about the needs and the assessment of what women need. And a lot of them are being pushed off, and fatality is higher because by the time they work through that and get the approval, they've expired.
That's very I for you to work in that field, especially if you're the one that's processing or answering those phone calls, to not know.
It's crazy.
It is crazy. In addition to coaching cancer survivors, you work with people going through grief, divorce, and caregiving. What similarities or patterns do you see in the way people navigate these difficult life transitions?
I think oftentimes they put too much on the plate. Being a caretaker, I know I did it for 15 years with my mom, and we all do it when we're parents. You're taking care of kids. I think the number one thing we have to remember is that you got to take care of you first. If you're not healthy, nobody's going to be healthy.
Right.
You can't take care of someone else and make sure they're good and you're not good. I don't care whether it's physically, mentally, or any area. You got to make sure you take care of you. You got to know when to say no.
Yep.
Oftentimes we, yeah, but we don't know how to say no, 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 no. You're not Superman and Superwoman. You've got to learn what your limits are, and you got to set boundaries.
I'm learning that. Learning to say no when I've
It's a
reached,
hard one to do because we're
it is.
used to juggling,
Yeah.
multitasking. But
Yeah.
sometimes you just have to stop and do one thing at a time.
You have a powerful motto: you make the choice, God will make the change. Can you
Mhm.
tell us how this belief influences your coaching approach, particularly in spiritual coaching?
Well, it all kind of sums up to you have to make the choice to let go of the wheel and let God do the driving. If you're going to do it, you don't need God. And the only way change can come about is you have to surrender everything
Mhm.
and allow Him to direct you, show you, and even provide those things that you can. So it's like letting go, but letting God.
What does a typical coaching session with you look like, especially for someone navigating the emotional and physical toll of cancer?
Well, the first thing we start out with is we start out with praying. We pray together and we ask God to come in and show both of us what it is that He wants to reveal and how He wants me directed to do what needs to be done in their lives. Because really, I'm the anchor that's holding them, but God is the head of the ship. And I've got to make sure that we're on one accord and that we're emptying ourselves so that we can be poured into. Because until we do that, we can't be effective.
Absolutely. You speaking a word today, Dr. Linda. So, as a Christian, how does your faith guide you in supporting others, especially in times of deep personal crisis like breast cancer, grief, or divorce?
Um, I think what really keeps it all grounded is when we focus on faith and not fear. Whenever that arises, I found that when you really get into the word and prayer and meditation, it can take the sting off of anxiety, depression, or whatever else is there. You don't have room, don't make room for it. If you just concentrate on positive things, that's not always easy to do.
Right.
But when you get into a pattern and teaching yourself how when things come up and it's overwhelming you, go get on something that's positive, that takes some energy away from that. And even if it's just sitting outside and just meditating, letting the sun hit your face, thanking God for the day. It's those simple things that takes that heaviness away. And I found that, like I said, when I concentrate more on faith and what God has done, it makes me appreciate where I am. Even if it's a trying situation or a challenging moment, I still have too much to be grateful for than to allow what to bring me into a pit.
Wow. Do you do one-on-one coaching sessions or do you do group sessions? What does that look like?
I do them all. If someone wants to come in and they want to do it solo, I'll do that. Many times I've had companies that come and want me to speak to their employees. Just did a session with a company that had about 285 employees who want to talk on breast cancer. So it doesn't matter whether it's in person, virtual. If you want it, I'll try to make sure you get it.
Awesome. Okay. So we're going to dive a little personal for a moment. But
Okay.
as a mother and a divorcee, what
Mhm.
personal life lessons do you share with clients who are experiencing similar transitions?
I think in the divorce coaching, it would be how not to lose your identity. I think when we get into marriages, we focus more on the other person than we do ourselves. And oftentimes we lose ourselves. There may be times when it may not be a divorce, it could be a short term separation. Those are times when you find out that, oh my God, I put everything in him or her, but what am I going to do now?
Yeah.
So it's crucial to make sure that even though you are a part of a partnership, you still have to remain to have your own identity. You can't just get tumbled up in that because it's not healthy for either of you.
Yeah.
Absolutely.
That's great advice. Great advice. You're also a motivational speaker and advocate. How do you craft your speaking engagements to leave a lasting impact on your audience, especially when discussing such emotional and sensitive topics like breast cancer?
I try to leave it to where they will be, hopefully, they come away knowing this journey is not about them, that it's about your purpose, what God is using your life for. Somebody on the other side is watching everything you're going through. They're seeing how, if you're saying you love God and you trust God and you know God's going to bring you through, they're looking at that. Is your word lining up with your walk?
Yeah.
And that's what I hope I leave at anything I do, is make sure that what you're saying is what you're living.
And looking ahead, what future goals or projects are you excited about in your mission to support and empower others?
I am looking at doing a couple of inspirational books in the next year. I think I've got some things that I've gone through that could really help. And I want to make sure that I get as much inspiration and encouragement out there that I can.
Well, definitely keep us posted on
So
that.
you gotta let us know.
Let us
We're gonna
know.
invite you back on the show to talk about it. Yeah. So for anyone who is listening who might be battling breast cancer, going through a difficult life transition, or acting as a caregiver, what final message of encouragement or advice would you share with them?
I guess the one thing that comes to mind more than anything is just make sure that what you do and what you're doing is really what you need to be doing. Because if it's not, don't do it. I don't want anyone caregiving out of pity or feeling like that's what they gotta do. No. You gotta make sure that whatever you're doing, that's your purpose, that's your mission. That's what you've been called to do, because it won't be perfected if you're doing it out of need or greed or just anything negative. Make sure it's all positivity and you give it your all. If you can't do that, then don't do it.
Wow. I feel like I need that message today. Driving your purpose and make sure that you are make sure it's in the heart and in the spirit when you do what you're doing.
Yes.
Right.
Yes.
Absolutely.
Because it's going to make all the difference in the world. You
So
can make me a peanut butter sandwich. If you really want to make me a peanut butter sandwich, it's going to be the best sandwich I could have ever eaten.
Yes.
Exactly.
If you're grudgingly doing it,
Yep.
I don't want that sandwich.
Right.
It's the same way we got to look at life.
Yep.
Absolutely, Miss Linda. This is only a snippet of the knowledge and the wisdom that you can share with our audience. So where can our listeners reach you if they're interested in coaching sessions or speaking engagements?
They can reach me at atimewellspent@gmail.com. They can reach me on Facebook. Just put in Linda Brooks Johnson and I'll pull up. Also on Instagram. And they can always reach me by my phone number, 678-308-8006.
We will be sure to put all that in the description box for our
Yes.
audience so that they can reach you. This was amazing today.
Oh, I enjoyed it.
And we want to thank you so very much for coming on with us today.
Oh, I enjoyed it. Thank you.
As far as our audience is concerned, you can always email us with your questions or show ideas at tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends, rate the Apple Podcast and Spotify, and leave a comment. It really helps the show get more support and gets the message out there to those who need it. You can find all of our social media links and a list of resources related to our conversation today in the description box, including how to reach Dr. Johnson. We release a new show weekly on TMI Sundays at noon on YouTube and all of your favorite podcasts. Follow, like, and share content with all of your friends. Thank you for watching. Bye.